You'll put the ball off to the side of the spine, not directly.
Hey everybody, Dr. Perry from Stop Chasing Pain. I'm thrilled to show you the 5 places that we teach all of our patients to use a vibration ball, what we call localized vibration therapy. You'll see me demonstrating it with our Mojo vibration ball. That's the ball that we sell on our website, stopchasingpain.com. Or you can simply go to Amazon and purchase any vibration ball that you like. Just make sure you put them on these 5 places that we're going to show you. You're going to notice some vast results in how you feel. It can decrease tension, decrease pain, help blood flow, help lymphatic flow, calm the nervous system down. These are very powerful physiological and anatomical places that we teach people to do, where you don't just arbitrarily start putting the ball anywhere that you want. So do these 5 places, and I think you'll notice a big difference in how you feel. Try to do them every single day for the rest of your life, and share in the comments below how you feel. Here we go.
Spot number 1 is underneath the collarbone on both sides. Spot number 2 is the center of the sternum. Spot number 3 is the center of the abdomen from the bottom of the sternum to the navel. Spot number 4 is the upper thoracics at thoracic 1, 2, 3, and 4. This one, you'll put the ball off to the side of the spine, not directly on it. Always do both sides. Doesn't matter which side you do first, as long as you do both. Spot number 5 is the base of the sacrum. Spot number 1, underneath the collarbone. This is one of the most powerful places you're ever going to use vibration for a couple of reasons. Number 1, this is where lymphatics get congested, stagnated, and stuck. So the lymphatics drain to the collarbones and what they call the lymphatic duct. 75 to 80% of the lymph in your whole body drains to the left side collarbone. The remaining drives to the right. When you have excess tightness or tension around the collarbone, below it, above it, in the neck, anything like that, you can compromise the drainage of the lymphatics. And remember, the lymphatics do a couple of things. They're the primary system in your body that's going to remove inflammation. They get rid of what we call muck. That's anything that's stuck inside of your body that shouldn't stay stuck inside of your body. If it stays stuck inside of your body, you're going to get sick, you're going to get inflammation. This is also spot number 1 of our Big 6 lymphatic reset routine that's gone viral around the world because it helps people feel so much better with their lymphatics. So make sure you look up at the top here and click and go to the Lymph Big 6 reset and do that as well. You can even use the ball on the 6 places. Really, really super powerful. Okay, so you do the left side, do the right side, that'll open up the lymph. Also sitting in this region are 2 very powerful nerves. One is called your vagus nerve. That's a cranial nerve coming off your brain stem in the back, cranial nerve number 10. You have a left vagus and you have a right vagus. It comes off the medulla in the brain stem. That nerve helps control the inflammatory reflex of the body and is part of your parasympathetic nervous system that helps you relax, heal, recover, regenerate, and take you out of hypervigilance, hyperarousal, sympathetic dominance, fight or flight that can slowly break your body down over time. So it's really important to stimulate that nerve because it's going to travel right here at the collarbone down towards the abdomen. So you'll get vagus nerve stimulation in here. You'll also get the phrenic nerve that sits next to it. The phrenic nerve controls the motor function, the movement function of the diaphragm muscle sitting below your lungs and above your organs, that every time you breathe in and out, that muscle should contract to help move your organs around. Very, very powerful place to hit with the vibration ball. We recommend 20 to 30 seconds on either side. If you have a cough reflex when you're doing it, that means you can stop. That's vagus nerve stimulation. So let's say you're stimulating here and you're aiming for 20 seconds and then you cough at 10. Take it off, you don't need to do it anymore. You got the stimulation of the vagus nerve, then you can move to the other side, okay? But if you don't cough, that's okay too. Just aim for your 20 to 30 seconds. Spot number 2 is the sternum. Very, very powerful location because you can also stimulate the vagus nerve that travels behind the sternum, wrapping along your esophagus that's going down towards the stomach into the organs below. This is also where your heart sits. This is where your lung sits. Lymphatics get stagnated here a lot. Very powerful emotional center of the body here as well. So when you vibrate here, you help move things in what's called your mediastinum, and you'll probably just feel so chill and so relaxed. Make sure you can continue to breathe normally when you do it. Spot number 3 is going to be in the abdomen, right between the bottom of the sternum and your navel. If you put your ball right there and press in a little harder, but don't cause pain, you're going to get the largest lymph node in the body that sits right there, called your cisterna chyli. Gets really stuck and stagnated. That will cause backflow of lymphatics all the way down to your feet, and even backflow that can go all the way out to your arms and in your brain. Is extremely powerful place that you need to put the vibration ball. And this is also your gut brain axis center. Your emotional center sits right here as well. Spot number 4 is going to be the upper thoracics. 1, 2, 3, 4 of the thoracics. This one's a little trickier to do. Somebody's going to have to either do it for you, or you'll have to lean against the wall or sit back into a chair that has a high back that you can put this on. I like to just take it from here, put it like this, right at the top, and vibrate on one side, then vibrate on the other side, whatever's easier for you. This one you'll really like. Why is that so powerful? Because the first 4 bones in that upper thoracic spine can control blood flow to the head, neck, face, and brain. So if you get a lot of tightness and tension and restriction in there, you'll feel a lot of symptoms up in this area. And many people treat this area, which you should, but where you need to go is the upper thoracics. Now, the last one is the lowest one. That's on the sacrum, the tailbone, okay? Vibrating that area is going to help your parasympathetic nervous system, because your sacral nerve, sacral 2, 3, and 4, are part of your parasympathetic nervous system that helps you heal, recover, relax, regenerate. So this will help you relax anything down in that abdominal, lower back, pelvis, hip region. Just take the ball, put it right in the center of the base of the sacrum, and vibrate that one. I like to do this one a lot longer. It's at least 30 seconds to a minute. If you can do all 5 of those areas on a daily basis, I think you'll know this can make a huge difference for you and how you feel. More energy, less tired, less fatigued, less lethargic. You'll get blood flow circulating, you'll get lymphatic flow circulating, and decrease pain as well, which is always a good thing. So give these a go. Let us know how you like it. Put it in the comments section below, and also make sure you share this with other people so they can get the benefit of using localized vibration therapy to help them heal, recover, and regenerate. This is Dr. Perry. Thank you so much for tuning in the video. Make sure you hit that subscribe button so you never miss a future video coming on out. Thank you so much.